Hello, everybody. My name is Dr. Colin Huntley. I'm an associate professor in the Department of Otolaryngology and Sleep Medicine and a board certified sleep specialist. And myself, along with my colleague, Dr. Moritz Boone, head up the Jefferson Sleep Surgery Program. And today we'll be talking about upper airway stimulation for obstructive sleep apnea. I want to talk about obstructive sleep apnea and give a brief overview about what this disease entails. We'll talk about upper airway stimulation and describe what it is, and this is the Inspire device specifically. Then we'll talk about the indications, the procedure, the complications, the limitations, and the outcomes of this procedure. Obstructive sleep apnea is a disease that's impacting millions of Americans. More than 20 million Americans have clinically significant, meaning moderate to severe obstructive sleep apnea. And this entails recurrent upper airway obstruction. So at the level of the very back of the tongue, the soft palate, the sides of the throat, those anatomic areas are collapsing over and over throughout the course of the night. This leads to snoring, choking, and gasping at night, poor sleep quality, and puts patients at risk for a number of cardiovascular variables such as high blood pressure, heart attack, stroke, and also leads to quality of life issues with fatigue, poor work performance, and limitation of daytime activities. CPAP is the typical first treatment modality for management of obstructive sleep apnea. CPAP works very well to control the number of events per hour and does help to limit the cardiovascular comorbidities. However, many patients have a very difficult time tolerating CPAP therapy. The literature shows us that anywhere from 20 to 80% of patients will not use CPAP. Generally speaking, about 50% of patients will not be using CPAP therapy 1 year after it was prescribed. So this leads us to upper airway stimulation. The Inspire device specifically is the only currently FDA approved technology that's available. And this is what we'll be talking about today. The Inspire device is a surgically implanted, medically adjustable device that is designed to manage obstructive sleep apnea. The way this works is there are 3 components that are inserted. There's a respiratory sensor that's inserted in between the ribs, a computer and battery pack that is termed the internal pulse generator, and the stimulation lead, which is placed on the hypoglossal nerve, which is the nerve that moves the tongue. The way that this technology works is that after it's activated, with every breath, the respiratory sensor senses respiration, which sends a signal to the computer and battery pack, which then processes that information and sends a signal to the electrode to gently stimulate the tongue. This allows for contraction and movement of the tongue forward to open up the airway and eliminate the apnea. As I said, there's 3 implanted components: the stimulation lead, which is placed on the hypoglossal nerve or the nerve to the tongue, and that's in the neck; the internal pulse generator, which sits just underneath the skin in the chest; and the respiratory sensing lead, which sits in between the ribs. There's also a remote that the patient will use to activate and control the device on a nightly basis, and the physician programmer, which is how we program the device in the office. So what are the indications for this technology? The FDA indications are age greater than 18 years old. There's no upper limit for age. Moderate and severe obstructive sleep apnea. So this is greater than 15 events per hour. Unable to tolerate CPAP therapy. A BMI, which is a height and weight calculation of less than 35. And specific anatomic findings on a drug-induced sleep endoscopy. This is a sedated airway exam where we watch to see what part of your airway is collapsing and causing the sleep apnea. Inspire works very well for specific types of airway obstruction, and this is what we're trying to identify for patients. So how is the procedure performed? It's outpatient surgery. We're able to do this through 2 incisions. Classically, this is taught through 3 incisions, but we make a incision in the neck, which is about 1.5 centimeters just under the submandibular gland or the gland in the neck. Then there's a incision in the chest underneath the collarbone that's about 2.5 inches, and this is where the respiratory sensor is placed and where the internal pulse generator is placed. Surgery takes about 3 hours. By the time the patient goes to sleep, they're positioned, the procedure is performed and woken up, and then they're in the recovery room and are able to go home the same day. Post-operatively, patients do very well and recovery is fast. Most patients are back on their feet and doing general daytime activities within 3 to 4 days. And the limitations are heavy lifting for about a week and overhand arm motion for about 1 month. So what are the risks of this stimulation? The title of this paper that I've cited on the bottom right of the slide is from the ADHERE registry. This is a large multi-center, multinational study evaluating over 1,000 patients that have undergone this technology. And one of the categories that this paper evaluated was complications of both surgery and the device. So when we look at surgical complications, we always counsel patients about bleeding, infection, the risk of anesthesia, scarring, weakness to the nerve that moves the tongue, and pneumothorax. That's a slight collapse of the lung from placement of the respiratory sensor. All of these risks are exceedingly rare. There's not been recorded, or at least in this paper, was not a documented bleeding issue with need to return to the operating room. There was only 2 infections out of more than 1,000 patients. Anesthesia is extremely safe. Most people heal up very well from the 2 small incisions that we make. There's not been a permanent weakness of the hypoglossal nerve that was documented. And the rate of pneumothorax is exceedingly low, especially in high volume centers. And we certainly constitute a high volume sleep surgery center. After patients recover from surgery, one of the common questions we get asked is about tolerance to the device and how does stimulation impact the patients on a nightly basis. Patients worry about sleep discomfort or stimulation discomfort, sleep disruption, issues with speech and swallowing because that tongue is being contracted over and over again, abrasions to the tongue, weakness to the tongue. These are all extremely rare issues that we come across. The vast majority of patients tolerate stimulation very well to the point where it does not disrupt their sleep and does not create arousals, which are specific changes in brainwave patterns during sleep that we see on sleep studies. This does not cause sleep disruption for the vast majority of patients. We've not seen any issues with speech or swallowing, and patients do very well in this regard. The tongue does not seem to tire out from repeated stimulation. And tongue abrasions happen on a very rare basis, particularly in patients who may have a bad or jagged tooth that the tongue is contracting against, but that's easily remedied with the dentist. So what are the limitations of this technology? The MRI is a limitation. So this device is approved for an MRI of the head and extremities, but not the chest, abdomen, or pelvis. So basically any MRI from the collarbones to the hips would not be approved. However, there is no limitation to CAT scan, ultrasound, X-ray, mammogram, or any other imaging modality. The battery lasts 10.8 years. So in about 10 years, we swap out the IPG, which is the piece in the chest. And then scuba diving is limited to greater than 30 meters. But lastly, what are the outcomes of upper airway stimulation? Again, from this large study, outcomes were studied. There's an 80% success rate seen with this technology, or approximately 80% success rate. And we define success generally as not needing CPAP or any other modality because the apnea is treated. 74% of patients noted normalization of sleepiness as measured by the Epworth Sleepiness Score, which is a commonly used sleepiness survey. Patients use this approximately 6 hours per night. And this is an interesting fact because every patient who is using this almost 6 hours per night was not able to tolerate CPAP. And satisfaction was very high. 93% of patients were overall satisfied. 95% of patients prefer this to CPAP. 94% would do it again, and 96% would recommend it to their family and friends. Thank you very much. I'm Dr. Colin Huntley again, and this is just a short description of upper airway stimulation, and look forward to discussing this more.